how many years ago you felt like you're absolutely healthy human being with no medical problems?
3 years ago.
So you were absolutely healthy.
Absolutely.
And so what happened 3 years ago?
Absolutely healthy. I moved over here from Arizona, moved to San Diego, started my new job in corporate America, and shortly after I moved here, around October of 2016, I started noticing that there was something obviously going on.
Could you recollect what preceded the onset of your symptoms? Do you remember having a tick bite? Do you remember having something unusual?
No, so that's one thing. Absolutely. I've never even seen a deer tick. I never had the rash. No, I didn't have any symptoms like that.
So going back to October of 2016, so what did you start experiencing at that time?
I'm a very, very busy, go, high energy type of person. That's how I enjoy to live my life, and I like to stay busy. So I thought when I moved here, starting my job in corporate America, that I was just extremely tired getting used to that adjustment. But over like 2 to 3 months of feeling that extreme fatigue.
So you realized that your fatigue is disproportional to what you would expect?
Yeah, I just knew that there was something off. It just didn't make any sense. Things were adding up. And then slowly but surely, other things started to spiral down from there.
So then what did you do?
So at that time, I went to a local doctor here in San Diego, and nobody knew what was wrong with me.
What did he tell you? Did he or she, what did they tell you at that point? So that it's up in your mind, or?
They thought at that time it could have been a virus that I was trying to fight off, because my glands were swollen, my skin was starting to get a little bit red and rashed out, but nobody knew what was going on.
And then tell us a little bit about your journey before you ended up in our clinic. So
so I think that's a really good point. I went to 18 different doctor's appointments. I was kind of passed along to each different department in one of the big institutions here in San Diego. But ultimately, I think with something like this, you have to be your own biggest advocate. You know your body better than anybody else, and I knew that there was something wrong with me.
And what kind of diagnoses were made during your journey? So what exactly, if you remember? Like chronic fatigue, hypochondria?
Chronic fatigue syndrome. There was another arthritis.
Like fibromyalgia.
That one. There was also, they tested me for all sorts of, like if I was allergic to any of my medicine, if there was a food I was eating, if there was like a mold outbreak in my house. I was like, no, I've been on these meds. No, I've lived in the house, for almost a year or so.
And then when you came to us, you mentioned that at one point you were at the urgent care or emergency room, and you got a couple of doses of IV antibiotics and start feeling much, much better, right? Did you bring it to attention to other physicians that antibiotics made a difference?
Yeah.
And what was their reaction?
So that was when it got to the worst point. I was in the ER for 3 days, and
what kind of symptoms?
I had 104 fever that wouldn't go back down. It was kind of stuck up there. My whole body was shaking. Horrible rash across my whole body. Extremely tired. And when I really started noticing feeling better was sitting up with the IV for 24 hours. And then I was like, okay, I feel good again, getting out of this place.
Your fatigue went away, so you did feel like a normal person again.
I really started to feel back to my normal self. My energy spiked back up. But I had like the heads of infectious disease visit me. I had the heads of the ER at that time, and nobody then could give a full diagnosis of what they felt was going on. But I did, and I always remember telling you that how much I thought that the IV really did help my symptoms.
Because I remember during our first conversation, you brought it up that I got IVs and I felt like I'm a new person.
Mm-hmm.
All right, and then eventually went to a dermatologist who sent you to us, right?
Yeah, which I'm very, very thankful for.
And so we diagnosed you with Bartonella infection, right, and Lyme disease, right? And so we started the therapy obviously with antibiotics, right? Could you tell us how did you react initially to antibiotics and what happened, kind of your journey through antibiotic therapy?
Yeah, so the very first, we started with one antibiotic every morning, and we started with a small amount.
Small dose.
Yeah, and it just wasn't working. I didn't think that it was strong enough, and I remember approaching you just being like, we're gonna need something stronger. So the antibiotics now that I've been on, I do 2 every morning.
Plus injections.
Plus the Bicillin injections.
And so what was the turning point? When did you start feeling better from your standpoint? What made the major difference?
To me, and this is what I would tell everybody, I know everybody's body reacts differently,
Right.
but what Bicillin has done for me has completely, changed my life in terms of how sick I was.
Right.
Like there were weeks where it was hard to get through each day. Now it's like I'm getting through every day, and maybe we'll have some bad days.
So why we're using Bicillin instead of oral antibiotics?
Mm-hmm.
And so my answer is that in general, we're trying to reach more or less steady concentration of the drug in your blood. And by doing injection of extended release penicillin, which is Bicillin, so we can achieve that goal easily, right? So that's number one. So number two, the journey through antibiotic therapy is not a simple one, it's a bumpy one, right? And you're dealing with side effects including various problems with your gut, yeast overgrowth and dysbiosis and other things. So when we're using injectable or infusible antibiotics, the frequency of side effects actually much fewer compared to oral antibiotics, and the reason is by the time when antibiotics reach your gut after IV or intramuscular injections, they neutralize in your liver, and so they're less damaging to the intestinal microflora. And it's our experience that typically takes around 2-3 months on injectable and infusible antibiotic to notice a difference. And we like to continue for somewhere between a year up to 3 years, depending on your response. Right? How many injections of Bicillin did it take to notice a difference in your case?
Well, first we did once a month,
Right.
and then we moved to
Every
twice a month.
2 weeks,
And then
every 10 days. Right?
I told you, I was like, Doc, we're gonna need more.
That's okay.
So I really started noticing the first difference when we did the twice a month. I really started noticing like that was helping me break through a lot of the body pain, and a lot of like just like the internal shakiness. I was getting like Herx reactions, but I kind of countered that with all the infrared saunas that I did. But moving, it was that conversation I had with you. It was just like, hey, I think that we're gonna need something stronger. And ever since we've been on every 10 days, it's just been like amazing how fast that worked.
Perfect. So again, because what we do here obviously is to educate other patients who are in the same situation. So what kind of message you would like to deliver
To other patients?
To other patients, yes, exactly.
I would say people would be lying to you if they said it was going to be easy, because it's not. It's extremely exhausting mentally and physically. It takes a lot of like time and scheduling. I think for me the biggest thing was the right attitude and positive mindset. I think that going through all these treatments and getting the medicines to try to heal your body, you need to have like a right mental state. It takes somebody who's really internally tough, like tough-minded, strong, and it's like a journey. It's not like a quick sprint.
Well, that's exactly what I tell my patients. It's a journey, and if you expect to get better within a month, it's not worth even trying because it's not going to happen.
Yeah,
it's the nature of chronic infections, right? And so I remember when I told you that it's going to be a journey, you were a little bit skeptical about it initially, right?
Just because I'm so quick and I would like things quick, fast reacting,
Right,
but
right.
I think and this is something I talk about with work and my family and friends, going through this, I wouldn't really wish it upon anybody, but it has I'm better off for
But
it.
you're back to your normal life.
Yeah,
basically.
I think it teaches you a lot about yourself.
So how important is family support and friend support? Is it important?
It's huge. Lyme disease, that's important that you said that, it's incredibly misunderstood, and a lot of times you don't feel like you can have anybody that you can go to who truly understands like what it is that you're going through. But to have that support is huge.
Okay. And so you've been on antibiotics for how long right now? So a year roughly?
A year and a half.
Year and a half. Do you have a fear that if you stop them, that your symptoms gonna get back?
I have a fear that if I stop the
So
Bisolin,
you do have a fear,
yeah,
right?
oh, absolutely.
Which is common.
hmm
So, but at some point,
It's just like the amount of work that I put in to get to where I'm at
Right.
today.
and
I don't
like
want to
we-
leave it up for any chance.
Like we discussed before, it's too early to stop it, but at some point we'll have to do it, right?
Yeah, we'll have to wean off.
Okay, all right, perfect. So when I told you that it's a bit long-term journey, how did you accept that stuff? How did you accept the whole idea that you're going to be on antibiotics for 6 months, a year, maybe longer? So did you get any kind of fears that it'll be too much? What was your reaction? Because I remember even your parents got involved. I was talking to them on the phone because they want to get some details why you need to be on antibiotics for such a long time.
hmm
So what is your answer on that?
At first, to be honest with you, I was relieved that I knew what was wrong with me and how we were going to treat it. I think after the 6 months, though, I was kind of like, okay, how long is this really going to take?
But now your attitude is different. Now you're afraid of stopping the
Yeah, I know now, and now I don't want to go off of it.
right?
Yeah.
Because you feel so good.
Yeah, because I feel so good, and I don't want to go back to how I was feeling before.
Right.
But I remember when you told me that, because you knew I was extremely impatient, and I had just had to come to the realization that on the positive side, I was happy to know that I had a doctor who
Right,
knew
right.
what was wrong with me,
Well, thanks.
and to move forward.
So, how bad were your side effects during the therapy? So, could you describe what was the worst side effect?
Going through treatment,
Yes.
a lot of swelling, a lot of Herx reaction swelling everywhere, like behind my eyes, my temple, my ears, everything in my legs. So I really try to counter that with doing the infrared saunas. But even that, right?
But you did benefit from the infrared sun.
Oh, absolutely. I would tell everybody, at least look into it.
Right, right.
Absolutely.
Okay. All right. Anything else? Well, thank you for the interview.
Thank you
So-
very much.